Hi, and welcome to the little apartment on the prairie. Since I'm dealing with this respiratory infection and thinking about the coronavirus and that kind of thing, I thought I'd talk a little bit about medical supplies that I have on hand, and you can think about what supplies would be useful for you to have on hand. Both in case of some kind of a disaster that means you can't go out and get medical supplies, a flood or a hurricane or whatever. Or, in my case, just because I live alone and I'm also in a small town, there's not a pharmacy or a grocery store that delivers. And if I get sick and it's hard for me to go out to get supplies, I might be out of luck. And because I'm in a small town, there might even be supplies that I want that I can't get here locally. So it seems like to me that it's a good idea to have things on hand. Now, I'm not one of those people that stores 2 years worth of food and water in case of the zombie apocalypse. But I do think some prepping is a good idea. It's a good idea to have some food and water on hand in case there's an emergency, in case your power goes out or whatever. And if you live alone, if you live in a very rural area, if you have a disability or a chronic illness, it becomes even more important to be stocked up on the supplies that you might need. We had some flooding in Nebraska last spring. It was terrible. I had not thought about how a disaster like that could prevent people from accessing healthcare supplies. There were people who are diabetic who couldn't get testing strips. There are people who relied on tube feeding, and they couldn't get their tube feeding formula delivered. Really serious things. And also people who couldn't operate medical equipment like a CPAP or tube feeding a pump because of power being out. And I know some people are going to think that I have way more medical stuff that I need, or that I'm really, overdoing it. And all I can say is most of the stuff is stuff that will get used. It's over-the-counter medication, it's Band-Aids, it's basic supplies like that. And when I cut myself and need a Band-Aid, I'm glad I have them in stock here in my house. So what supplies do I have? I have basic first aid supplies like Band-Aids in a couple different sizes, Neosporin to put on wounds so they don't get infected. I also have rubbing alcohol to disinfect things. I have some gauze and some larger bandages. I have tweezers. I have disposable gloves. They're not sterile gloves, which I'm not sure when I'd have a need for sterile gloves, but they're just regular, like latex gloves. And now I have a couple cloth surgical masks that I talked about the other day in the video about the coronavirus, and I'll put a link to that down below too if you didn't see that one. A thermometer. I have a couple different things, like I have a knee brace that I got when I sprained my knee and went to urgent care. I have a wrist brace I got from the ER once. I have this shoulder brace I bought when my tendonitis was really bothering me. I have a sling that I got when I had elbow surgery. Hi, Whiskers. So these are things that I didn't go out and buy for the purpose of having them on hand in case somebody gets injured, but they're things that I ended up with because at one point in the past I was using them, and so I just saved them. Then I have basic over-the-counter medications like acetaminophen, which is Tylenol. I don't have any ibuprofen because I'm not supposed to take NSAIDs, but that's something that a lot of people would probably want to have on hand. I have Benadryl, which is good for allergies. I have antacid in case there's a stomach issue. I have Imodium for diarrhea. I also recently picked up some Pedialyte, which is like an electrolyte replacer that people use for babies or toddlers or little kids. But adults can use it too. And especially if there's some kind of a situation where you wouldn't have water for a while, you'd have limited access to water. You can get diarrhea, you can get quickly dehydrated. Replacing those electrolytes can be important, and it's cheap. What else do I have? I have a bunch of natural remedies. I have echinacea tincture, plantain tincture. I have some herbal teas like ginger tea that I use for an upset stomach or heartburn. I have vitamin C that I use to boost the immune system. I have raw honey that I can use to boost the immune system. And it's also supposed to be good for like seasonal allergies if it's local honey, which mine is. It's just a good idea to kind of look at what are common illnesses or injuries that people might get and what things you can stock up on so that if you get sick and you can't get to the store right away, even if it's just that you don't have money till payday, you've got some basic supplies on hand. Another thing that's a good idea to have on hand is a first aid book. Even if you know first aid, it's a good idea because in an emergency, it might be hard to remember certain things. And it's a good idea to have it in a book that's in print form because if there's an emergency where your power goes out, that way you would still have access to it. It's also a good idea to know CPR, and if you don't know it, you can take a class. It's better to learn it in a class than from YouTube or the internet or a book because in the class you get to actually practice on a dummy. So that would be a good idea to take a CPR class if you've never taken one. Something else that I have on hand is a couple doses of the Plan B pill, which is an emergency contraceptive pill for women. And the reason I have that is because pharmacies sell it over the counter. You don't need a prescription. You can buy it at someplace like CVS or Walmart. But pharmacists currently are legally allowed to refuse to sell it to you if it's against their religion. So if they think taking the morning after pill is a sin, or that the fact that you're pregnant is a sin, they can refuse, or that you might be pregnant because you're taking it before you would know that you were pregnant. But anyway, if they think it's a sin, they can refuse to sell it to you. And in an emergency, if I get sexually assaulted, I don't want to get pregnant, and I want to have access to emergency contraception. And since pharmacists could refuse to sell it, and I may not feel like driving around from store to store to find a place that'll sell it to me, I just ordered a couple doses online and have it on hand for emergencies. And it's something I think all women should think about. Let me know what emergency medical stuff and healthcare supplies you keep on hand, and if there's anything important that you can think of that I'm missing.